This is Stu King's Vlog 1, Skills versus Capacity in the Weight Room. The aim of this vlog is to identify whether an athlete has a skill issue or a capacity issue. Athlete 1 is an athlete that has a few years experience in the gym. As you can see, I've included both a lateral and a frontal view. The lateral view shows a solid view of the bar trajectory and the knee position during the squat movement. The frontal view highlights a positional view for the bar height, the hip position, foot position and client gaze. I've indicated the bar trajectory with a green line in the next one for an unweighted and weighted squat. When the athlete increases the weight, she has less control consistency during the both ascent and descent phase. During the bottom phase, the weighted squat has an equal split of hip and knee, whereas the unweighted is more of a hip dominant moment arm. As we can see here, athlete 1 shifts her weight from her right to her left. We can clearly see with this zoomed in footage that athlete 1 clearly shifts her weight. This is more prominent on the posterior view and will be a clear factor to why the athlete struggles to get a consistent bar height. We can clearly see in the posterior view that the athlete's left hip externally rotates and the right hip internally rotates. The athlete indicated that they are currently suffering from a lower back injury, and this could be a compensatory movement to move out of a pain position. Another capacity issue identified was the lack of depth within the squat. As we can see, athlete 1 appears to have moderate anterior knee translation with them only just going past the toes. When testing the ankle mobility in both the left and the right ankle, they appear to be able to get the same amount of mobility as when in a weighted squat position. Athlete 1 also has some skills to work on with their gaze, their elbow position and their hand position. As you can see, I've selected several exercises to develop the athlete's range of motion and strength during the transition between descent and ascent. I've selected the squat hold and eccentric squat to develop the strength, and a heeled raise squat and a pole squat to allow the athlete to develop their range of motion. Athlete 2 is an experienced gym user but had no formal training on her squat. As you can see, I've included a lateral and a frontal view. The lateral view highlights the knee depth, the trunk flexion and force direction, whereas the frontal view highlights the gaze and the hand position of the athlete. I've indicated with arrows the excessive trunk flexion, the anterior translation of the knee and the client's gaze. As you can see, I've indicated the bar trajectory here, and as the client has an excessive forward flexion, which comes into play to counterbalance as the hips move back. This movement makes it a hip dominant movement and therefore increase the shear load through the lower vertebrae, which is likely caused by inactivity or weakness in the posterior chain. We can see here with athlete 2 that they begin the movement through their knees, and during the descent they typically drop with minimal control. As the knees hit an end of range of motion early, the athlete is forced to continue the movement through forward flexion of the trunk. As we can see, athlete 2 fails to hit a parallel depth with the squat, and this does not change from a weighted or non-weighted squat. The primary focus with athlete 2 is to develop their squat depth through the use of target squats and the cues of hips back, and pole squat with the cue of sit deep. Another cue of chest up will also be used. I've included a comparison of athlete 1 and 2. Athlete 1 is a capacity issue because they deviate from the starting point when we increase the weight. However, athlete 2 moves anteriorly of the center line due to the increased trunk flexion. The second exercise I've included is a split jerk. Athlete 1 has limited experience in performing this type of exercise. As you can see, I've included a lateral and a frontal view here. The frontal view provides us with a good position to see the client's hand, elbow position and the bar height. whereas the lateral view provides us a good view of the ankle, knee, hip and bar trajectory. I've indicated issues with client 1 with arrows on the screen, highlighting the knee and shin position, the bar position and the elbow position. Here, athlete 1 from the split jerk can be clearly seen not fully extending their elbows, in particular their right elbow. As we zoom in, we can clearly see that when they drive the bar up, their grip is loose on the bar, which could indicate an issue of why they are unable to fully extend. As we can see here, there is over 10 degrees difference between the right and left arm. This is the causative factor for the client being unable to get the bar level. We can clearly see that this causes athlete 1 issues in having the bar level in the start, the receive and the recovery position. We can clearly see here, athlete 1, upon landing, the shin goes past a vertical position. And as we zoom in on this, we can see that the knee translates almost past the toes. This could be down to the excessive hip drive as the athlete tries to force the bar into a posterior movement. This could be down to an issue with athlete's flexibility, which will require further investigation to be able to identify this for sure. Freeze frame with the angles included clearly demonstrate the shin going past the vertical position. To address highlighted issues with the lack of elbow extension and shin position, I've selected the strict press and push press with the phrase of punch up and tight grip to assist with the elbow extension, and stomp it out and targets with split jumps for the foot position. Athlete 2 is an experienced gym user with over 15 years experience of training within the gym. As you can see, I've included a lateral and a frontal view. The lateral view shows us the shin, hip and bar position, whereas the frontal view gives us a good view of the grip, the elbow position and the bar level. As we zoom in on the frontal view, we can clearly see that the left hip externally rotates, causing the heel to come inwards. This is very prominent during a weighted split jerk in comparison to the unweighted seen with the arrow. This would indicate an issue around the hip and in particular the glute maximus, which is obviously translating down the leg for the action of the foot turning out. To investigate this further, athlete 2 has performed a standing stalk on both sides, and it can be clearly seen via the arrow that there is clear stability issues on the left side and a knee valgus movement indicated by the arrow. These all indicate issues around the hip. As mentioned by Cashman 2012. We can clearly see here that athlete 2 is able to move the bar consistently vertically during unweighted and weighted split jerk. However, the athlete does demonstrate limitations with the tricep and the overhead position. This could be to do with the fact that it's such a powerful movement, as mentioned by Soriano 2019, as this athlete has reasonably good mobility within the shoulder joint as performed during the static shoulder press. To develop the athlete further, we'll be using exercises such as the one shown, plus also posterior starting exercises such as the split jerk from behind the head, so that the bar starts in a more posterior position. To use and strengthen the hip area, we'll be working on exercises such as glute bridges and glute thrusters. I've included a comparison of athlete 1 and 2. Athlete 2 has a nice vertical shin, whereas athlete 1 does not. The knee has moved anteriorly, therefore increasing the forces on the anterior side. To conclude, athlete 1 of the back squat and athlete 2 of the split jerk are the capacity athletes, and athlete 2 of the squat and athlete 1 of the split jerk are the motor skill athletes. The primary difference between the two sets of athletes are that the motor skill athletes require further education into how and where their body should be positioned, whereas the capacity athletes know where their body should be positioned, but they are restricted by their body itself.